Can you tell us, how does urinary incontinence affect a woman's emotional and psychological well-being?
Yeah, so it is a huge problem. As women, we are taught to look beautiful and be this whole person and be what everybody else wants. And then here we are. If we are affected by urinary incontinence, there is the shame, the embarrassment, the social stigma of it. Um, it creates so much psychological distress as women are feeling judged and ridiculed. I mean, how many jokes are there about that? And I think there is also a problem in that women are social creatures, and yet this is something that we do not share and we do not discuss. So we sit here in isolation thinking that we are the only ones suffering from it, and it's embarrassing and it's humiliating. And that self-imposed isolation will then lead us towards anxiety and depression. I mean, women will be and just in general, incontinence, um, the the potential for urine leakage in public will increase your anxiety, and then suddenly you start looking, where is the bathroom at, you have to worry about everywhere you go. Are you going to have access to a bathroom? And then you're going to see people start limiting their activities and such just because they are going to potentially be in an unfamiliar surrounding and situation, and then they're not going to know where the bathroom is. And that creates so much distress within a person. And then from there, the social withdrawal just because they have a fear of leakage. And it then will start impacting the quality of their life as they start uh, retreating from social activities. And then it creates problems within relationships because suddenly you are not going to be able to be that person that you were once before solely because you are so concerned about the incontinence. And then it is going to impact sexual health because how can you feel as if you want to participate in sexual activities if you're constantly concerned about leaking urine with your partner? So this will then further create lower self-esteem and low self-image and just decrease your confidence, and it is just going to impact your professional life. I mean, how are you going to hold a job if you need to go to the bathroom every 15 minutes due to a situation within your bladder, whether it's any number of potential diseases? And then, here we are, we know as an occupational therapist, as a pelvic floor therapist, we are taught how sex is an ADL, an activity of daily living. So you're not able to participate in that. You are having trouble with your toileting because you need to be able to get to the bathroom. You suddenly have to change how you're dressing because you need to have that easy access in order to get to the bathroom in time. People are going, just like Dr. Cohn said about limiting your fluid intake, people are going to be watching what they're eating and drinking. And then it's just going to impact the person as a whole and just create so much distress. And it's sort of just like he was saying, that situation, what's coming first, the incontinence or the anxiety, depression, we don't, it all sort of just blends together and becomes a huge problem for a person. And we keep hearing that this is normal. People will say that it's normal, but it's not. It's a common thing, but people don't discuss it and they're not told about it. So therefore it just becomes isolating and everything that I just said, you're just going to suffer as a person.
Thank you so much for sharing generously. You're really helping to shape the true physiologic and psychological impact. Let's build on what you shared. Can you give some insights into the social stigma associated with urinary incontinence and how it affects the seeking of treatments by women who experience urinary incontinence?
Yeah, so um there are a lot of delays in seeking of help for it. Um, you know, usually a lot of times somebody is not going to actually mention it to their provider until it is possibly a huge problem. And as was said, they're getting the UTIs and everything else, but there were steps along the way that could have been taken in order to prevent it from having gotten to the extreme case that it had become. Just the idea of discussing it when people feel so lonely and isolated, it's very hard to address. And their conversations are just not being had, whether it's from the medical side or the patient side, or just as people in general. We're not addressing the fact that this is unfortunately a common um, situation that can occur to someone based on a myriad of reasons. And therefore, they're not asking for help. They are potentially not even reporting. I mean, Dr. Cohen said that it largely, or more so, is affecting Caucasian women. However, what if the other women, whether they're Black, Hispanic, Asian, anything along those lines, what if they are just not reporting it? Um, and not just that, there could be a cultural or a religious divide that does not allow a person to discuss it. Um, they may not be fully disclosing the extent of their incontinence solely because they are so ashamed and embarrassed about what is happening to their body. And since they don't know that other people are experiencing the same problems and symptoms, they're going to think that they're alone. So they're not going to do it because of that social stigma, that negative social stigma. And then, they may be trying to manage it on their own. And that is wonderful, but there could have been steps along the way that, as professionals, we can introduce them to. There are some amazing devices that are coming out that we can utilize in order to help patients, help women um, work towards decreasing the incontinence and possibly even preventing it if we can take the steps early on. So, and the other thing too is uh, when somebody is self-managing and they are self-paying for their products, such as the adult diapers, which I truly hate that term diaper, but that's besides the point. But using those incontinence briefs or the pads, and all of these things just begin to create such an expense. So then a person may start using them and wearing them well past the wear time or wear date that they should, in the sense that the pad may be completely filled, but they're going to keep using it because it is too expensive to continually use more, and that's when we're seeing more and more problems. So it truly is, it begins with a social stigma, and then it affects the whole person, and it can affect them not just monetarily, not just socially, but just in terms of their own global level and global world.